I'm Micheal Kirby, and I am an ambassador of APCOM, and I'm proud to speak to this civil society forum that is addressing the issue of the global strategy on AIDS and what must be done to get an end to AIDS by 2030. In March of 2021, UNAIDS in Geneva issued a most welcome statement about the importance of the strategic development goals and also of the strategy of UNAIDS to get to zero by 2030. Zero in new infections, zero in no more deaths, and zero in an end to discrimination. And that is a good strategy. And I support that strategy, and APCOM supports that strategy. But the question is, are we adopting the most effective means to get to that strategy? When one looks at the political declarations that have been made by the United Nations General Assembly, uh, beginning effectively by 2001 and right up to the present time, we can see that to some extent we have lived in the years that the locusts have been about us, because we have not got to an end to AIDS. We have not got to an end to HIV infection. And in fact, in some respects, we have been ignoring the strategies that we know have to be followed. Now, those strategies are well known. There's no debate about them. There is no real question about what you need to do to get to zero. You have to address the target groups that are most at risk of becoming infected with HIV. And unless we do that, we will not get to zero. And we can pass as many resolutions of the United Nations as we want to, but we will not be advancing the cause that has been explained in publications such as this book, which was the report of the Global Commission on HIV and the Law, which I took part in 2012, with Prasada Rao and other distinguished experts who are associated with APCOM. And what we said here was what we had said earlier in the Global Commission on AIDS of, of 1984. And that said that we must address specifically and directly the populations most at risk. Those populations are well known. You know what they are: men who have sex with men, people who inject drugs, transgender persons, sex workers, people detained in prison, adolescent girls and women. And these specially vulnerable groups have to have their needs addressed, or we will not get to zero. So these are the necessities of the moment we are living through. But there is another necessity. In the last year and a bit, we've had a new pandemic which has confronted the world and which has put enormous strains on the global health needs and on the budgets for public health in countries everywhere. Of course, I refer to COVID-19. And therefore, if we don't address that additional burden which faces humanity, we are going to go backwards. And that is why this is a moment of truth. This is a moment of truth for civil society. We must face the truth that we must face specifically and expressly the vulnerable groups. We must name them in the political declaration. It's no good pussyfooting around and talking about specially targeted groups. We have to name them. We have to recognize their dignity and their rights, their human rights, their right to health. And unless we do this, we are not going to get to zero. And this is the message that I believe civil society and APCOM must bring to the table of the United Nations and must bring to the attention of UNAIDS, of the World Health Organization, and of all the others who are truly committed to getting to zero by 2030. Let's name the groups: men who have sex with men, injecting drug users, sex workers, uh, women and girls, adolescent girls who are prone to infection, transgender persons, and persons in prisons and detention. If we don't name them, we will not respect them and we will not get to zero. So that is the message that we learned in the Global Commission on AIDS 20 years ago. It's the message we expressed in the Global Commission on HIV and the Law 5 years ago, and it's what we must take to the United Nations in 2021. Otherwise, 2026 and 2030 will come and go, and we will not be at zero. That is the message we must give the United Nations, and we must be blunt, direct, and clear. 2, 3, 1.